When you start working with your pain in a new way, through education, somatic tracking, graded exposure, emotional awareness, and thought work, it is natural to hope that things will simply get better and better in a straight line. You might picture your pain graph as a clean downward slope, from high to low, with no bumps. In reality, recovery from chronic, nociplastic pain almost never looks like that. It is much more like a zigzag. There are periods where things feel clearly better, then days or weeks where symptoms spike again, sometimes for reasons you can see, sometimes out of the blue. There are stretches where your progress seems to pause completely. You may find yourself wondering, am I back to square one? Did I imagine those improvements? From the outside, this can feel discouraging. From the perspective of your nervous system, though, it makes sense. You are retraining patterns that have often been in place for years. Your brain is learning to interpret signals differently, to lower its threat level, to trust your body more. That learning does not happen all at once. It happens through repeated experiences, and it is constantly influenced by stress, sleep, emotions, and life events. So first, it is important to normalize. Flare-ups and plateaus are part of this process, not proof that it is failing. A flare-up, in this context, is a temporary increase in pain or other symptoms, usually over hours, days, or sometimes a week or two, that eventually subsides again. It can be intense, it can be scary, but it does not necessarily mean new damage. It often means your nervous system has been triggered or sensitized by something. More activity, more stress, less sleep, emotional strain, illness, or even positive changes like travel or new projects. A plateau is a period where your symptoms seem to hold steady at a certain level, without much change, even though you are practicing. Plateaus can be frustrating because they feel stagnant. But they can also be times when your nervous system is consolidating learning beneath the surface, preparing for another shift. The first step in working with flare-ups and plateaus is to distinguish them as best you can from true medical red flags. Earlier in the course, you learned about red flag signs: unexplained weight loss, persistent fever or night sweats, new or progressive weakness, changes in bladder or bowel control, sudden severe headaches or chest pain, and so on. Those are situations where you should seek medical evaluation, regardless of where you are in your PRT journey. A typical flare-up, in contrast, tends to feel like more of the same pain you are familiar with, even if the intensity is higher. It often follows a pattern you have seen before. After a stressful week, after a change in routine, after sleep loss, after trying a new activity. It may be accompanied by more fear, more catastrophizing thoughts, more tension, but not by alarming new neurological symptoms or systemic signs of illness. If you are ever genuinely unsure, it is okay and wise to check with a health professional. One of the goals of PRT is to reduce unnecessary fear, not to leave you guessing about serious conditions. In fact, knowing that you have a plan for when to seek medical help can make it easier to relax when flare-ups that fit your familiar pattern occur. Once you have ruled out red flags, the question becomes, how do I respond to a flare in a way that supports nervous system retraining instead of reinforcing fear? This is where having a written flare-up plan can be extremely helpful. A flare-up plan is a small document you create when you are relatively calm, which you can then refer to when symptoms spike and your thinking becomes more panicked. It is like leaving a note for your future self. Here is how we handle this. We have been here before. We are not lost. Your flare-up plan can include several elements. One element is a brief reminder of the PRT model. For example, you might write, "Flare-ups are a normal part of retraining a sensitive nervous system. This increase in pain does not automatically mean new damage. My brain is turning up the alarm because it feels threatened, not because my body is falling apart." Another element is a short list of your personal early warning signs. These are clues that a flare might be building. Maybe your sleep has been poor for several nights, your stress has been high, you have skipped your usual movement or tracking practices, you have had a big emotional event, or you have done more activity than usual. When you see these signs, you can shift into extra care mode earlier, sometimes reducing the intensity or duration of the flare. Your plan can then outline specific actions you will take during a flare. Some of those actions might be aimed at safety and calm. For instance, doing a few minutes of slower breathing, spending a short time with somatic tracking, remembering that flares often make sensations feel more intense, but that you can still observe them, using your supportive inner voice to counter catastrophic thoughts, and engaging in small, soothing activities that you find grounding, like warm showers, gentle stretching, time in nature, or talking with a trusted person. Other actions might involve temporarily adjusting your activity level, not as a panicked retreat, but as a strategic recalibration. That might mean reducing the intensity or duration of your graded exposure exercises for a few days, not eliminating movement altogether. You might say to yourself, I am dialing things down, not stopping. My nervous system needs a bit more gentleness right now. Crucially, your plan should include what you will say to yourself about the flare. Because often, the thoughts you have about a flare are just as painful as the sensations themselves. You might write down phrases such as, "This is a surge, not a verdict," or "I have had flares before, they have passed, and this one will too," or "I am allowed to be upset, and I also know that this is my nervous system being loud, not proof that I am back to zero." You can also add a reminder to look back at your progress over a longer time frame. During a flare, it is easy to feel like you have never made any progress. You might forget that, a month ago, certain activities were impossible and are now part of your life again. Your plan might say, during a flare, look at your notes from earlier weeks. Remember what has changed. Tasks you can do, fears that are less strong, times when pain has been lower. Let those memories balance the current intensity. Alongside flare-ups, plateaus deserve attention too. A plateau can tempt you to think, nothing is happening. This is pointless. But often, a plateau is a sign that your nervous system is adjusting to a new baseline. It has moved from, say, an 8 out of 10 fear level to a 5 or 6, and is staying there while it tests the new setting. During this time, changes in pain intensity may be subtle or slow, even as important foundational shifts are continuing. When you notice a plateau, it can be helpful to do a gentle review of your practices. You might ask, am I still consistently engaging with the core skills in a way that feels kind and sustainable? Have I slipped into doing less somatic tracking or exposure without noticing? Is there an area, emotional processing, thought work, lifestyle, that could use a bit more attention? This is not about blaming yourself. It is about curiosity. Is there anything I might adjust? Sometimes, the best response to a plateau is actually to keep going steadily, without major changes. Trust that with time, your nervous system will continue to learn, even if you cannot feel it week by week. Other times, a small tweak can help, trying a slightly different exposure activity, refining your daily 20 routine, or adding a bit more support in the emotional or cognitive realm. Your flare-up plan can include a section for plateaus too. You might write, if things feel flat for a few weeks, remember that not feeling worse is also information. Ask yourself what tiny sign of progress you can notice. Maybe less fear, more engagement with life, easier recovery after activity. Consider one small change to try, but avoid overhauling everything out of frustration. Above all, both flares and plateaus are moments to practice the compassionate inner voice you have been developing. This is when the old habit of self-attack can be strongest. You might hear thoughts like, you are failing, you did this to yourself, or you will never get out of this. In those moments, you can respond deliberately. This is a very hard moment. Of course I feel discouraged, but this flare or plateau does not erase my efforts or prove the future. I am allowed to be human. I can take care of myself and continue learning. As we finish this video, consider setting aside a little time soon, ideally on a day when your pain is at least somewhat manageable, to actually write out your flare-up plan. It does not have to be long. A page or two is plenty. You can include your reminder of the PRT model, your early warning signs, your calming and supportive actions, your temporary activity adjustments, and the phrases you want to remember when your mind is screaming the opposite. You might keep this plan somewhere easy to reach, on your phone, in a notebook, or printed near your bed. When a flare comes, and it almost certainly will at some point, You will not have to invent your response from scratch. You will already have a wise version of yourself saying, "We have been here before. We know what to do. This will pass, and it does not define us." In the final video, we will step back even more and look at your longer-term path. How to think about the coming weeks and months, how to involve your relationships and environment, and how to keep orienting toward a life that is richer and freer, even as your nervous system continues to learn.